Okay, hello everyone. This is DeLacy again, coming from Wisconsin to let you know that it has been a whole year since I've had the brain tumor removal, which was done February of last year, February 19th to be exact, of last year. And I had my final MRI done 3 weeks ago, um, and they were doing them every 3 months. And so my final MRI was done about 3 weeks ago, as I said, and I came back with total clearance. Just wonderful. So I'm eternally grateful to God that I don't have any residue of a tumor left, and I don't need radiation. I did not need radiation, and I did not and do not need chemotherapy. So for that, I'm eternally grateful, because that would have just been horrible had I had to have radiation. The last time we spoke, I was letting you know that I was going to do some kind of texturizer or something in my hair, because it was just so, the curls were so tight. Like my beautician, she was not able to use a comb when she put the relaxer in. And as a matter of fact, she says, your hair is so tight, I have to use my fingers. So she put the gloves on, and that's how she relaxed my hair, because a comb would not go through it. And that was even after I had combed it already and she had went through it. And so, I mean, it is what it is. So I naturally need some kind of relaxer, and I thought that I could have gotten away with just going natural. However, everyone is not able to go natural. For those who have and are able to go natural, I applaud you. Yay! Because if I don't have to do this, I would greatly appreciate it. Okay, now for the next thing. And my hair, it was longer, but about a about a week before my last MRI, it started falling out really bad, because it was shoulder length. And it just started falling out, and I was like, what in the world is going on? Why is my hair falling out? And so I'm thinking maybe I need to do more moisture, maybe I need protein, maybe I need to stop relaxing. I didn't know what it was. And so I like, okay, I wasn't really sure. But in any case, um, long story short, I just wanted to come on and let you all know that April 22nd, I will be undergoing another surgery. This time it is to possibly remove either the entire left kidney or just part of it. When I went to the doctor to have my last MRI, my oncologist referred me back to the urologist, and the urologist said that the pain that I had been having in my left side was most likely just like a stomach migraine. Never heard of a stomach migraine, but in any case, he gave me some pills about 6 months ago for the stomach migraine, and I took them maybe 3 days, because they were not helping the pain. They were actually causing the pain. So I stopped taking them, and I let him know this. And then he says, well, that doesn't sound right. Let us do some more tests. So he had me do another MRI of the left side. This time they were focusing more on the kidneys. And so they did a dye contrast MRI, and they found something there. So my oncologist says, well, they're going to have to do a CAT scan to see if it's just a cyst or if it's cancer. Now, I've had a CAT scan of the kidneys. I've had an MRI of the kidneys. I had an ultrasound of kidneys. I even had an endoscopy and a colonoscopy all in one day. The endoscopy and the colonoscopy. Can you imagine, from the top and the bottom at the same time? But in any case, so this was my second colonoscopy in 7 years. And this time they found a mass on the kidney. And so I asked the doctor if it was a cyst. And all the urologist did was shook his head no and kind of put his head down. So then I go upstairs to talk to my oncologist to find out if they can tell me what it is. And the oncologist nurse, she came out to talk to me, and I said, well, the doctor said that they could tell if it was a cyst or if it was cancer. So which one is it? And the nurse said, well, it's not a cyst. And so I look at her and I said, it's not a cyst? They said, no. And so I'm asking, well, then if it's not a cyst, what is it? She says, well, it's not a cyst, so it's, and I said, cancer. And she shook her head, yes. And so therefore, they're going to go in on April 22nd, look to see if it's cancerous or if it's just a mass. Now, the good thing is that the mass is contained in just this one area in the left kidney. And that is what's causing the pain that I've been having for the last 5, 6, 7, 8 years. Why it wasn't found before then, I don't know. But I'm just grateful to God that they found it in time. It is contained in one area. They feel that they can get it all out with this one surgery. So I'm like, hey, if you have to take the whole kidney, take the whole kidney. Do what you got to do. But just know it's like April 22nd, I'll be undergoing yet another surgery. And my prayers is that they don't have to take the kidney. They'll find out that it's not cancer there. They won't have to do any radiation or chemotherapy because I just don't want to do either of those. So my eating habits are going to have to change yet again. As you all see, I still haven't lost all of the 15 pounds that I gained when from the last time. I have lost all but 6 of those 15 pounds. I'm still trying to lose. It's a struggle with me not having a thyroid and going to work in the office where I sat down the majority of the day. It was really difficult for me to get up and move around because what I do, I usually sit at a computer just about all day and I do paperwork. And so since then, I've been at home dealing with the pain, and I'm going to get done with this in a few minutes because I can feel the pain starting to come. And I usually get pain every day. And sometimes it lasts for 15 minutes, and it can go all the way up to 2 hours, excruciating pain, to where all I can do is sit in a quiet, dark room with a heating pad on my side and wrap myself in my electric blanket. Other than that, there's nothing really that takes away the pain anymore. I've done the naproxen, I've done ginger ale, I've done baking soda, I've done mustard, I've done just about everything. And there's times where it hurts to even cry. If there's tears running down my face, I sometimes can't even wipe my face because it hurts to move, and sometimes it even hurts to breathe. So therefore, for those of you that know a word of prayer, please keep me lifted up in your prayers, and just know that once this surgery is done, I will be back to give you all another update on what's going on in my life. Thank you all again for watching. I appreciate it. Thank you.